Wait, stop. Let's learn to lift heavy things without injuring ourselves. Welcome to this new episode. Let's get started. All right, so this is the subject that we're going to talk about today. And in order to do so, we have a special guest. That's right. Our special guest is not just someone who is amazing at helping others recover their health, he is dedicated to improving the quality of their lives for real. This calling or passion, we could say, started at a very young age when he realized there had to be more than just painkillers and other type of drugs to help relieve the discomfort caused by injuries from surfing, dirt biking, skateboarding, etc. So he learned firsthand that you need to take care of those injuries when he was very young. He just took it upon himself to find something that he really liked, and then it just became a way for him to help others. Before being a chiropractor, he studied biology at the University of San Diego, getting his Bachelor of Science. As a chiropractor, he has traveled to remote areas of El Salvador and Jamaica to bring chiropractic help to other people on the countryside, where he treated people of all ages, giving them a better quality of life. He also graduated from Life West Chiropractic College in Hayward back in 2014 and has been running a successful practice in Walnut Creek, California ever since. And I can honestly say that he is a hardworking, people loving expert that enjoys helping others with care, detecting exactly what is the real cause behind the problem and doing the right handling for it. And we are very proud to be helping him and his clinic, Congruent Chiropractic, to service others and expand. So let's give a very warm welcome to our special guest of today, Dr. Trevor Minton. Welcome, Doctor.
What's up, guys?
Excellent. We're very happy to have you here. Thank you very much.
Yeah, I'm happy to be here.
Fantastic. So today we're going to talk about what happens when someone lifts things improperly, how to avoid those injuries, and what is an excellent approach to heal from that. But before getting into it, please, in your own words, tell us your story of what drove you to become a chiropractor.
Yeah, so that actually dates back to when I was probably a teenager. I was going to the chiropractor fairly frequently just because of my own problems. But the tipping point for me was, a lot of my friends growing up were also working in construction. It was a one job you could get before before you were of age to actually work legally. So a very close friend of mine was lifting something really, really heavy, and this kind of also ties into today's topic. But uh, obviously, that thing was too heavy. He was lifting it improperly. He blew a disc out of his back, which then created all kinds of pain problems for him. And so he went through the whole medical model of painkillers and back surgery and all of these things, and that just never ever helped him. It never worked out, and he ended up having to go down a longer road of painkillers, which never ever turns out well for anybody. So that was when I knew that I had to figure something else out for at least the other people that were out there.
Yeah, I understand that. But it's great that, you saw it firsthand and then you saw it on somebody else and then it just became your thing, your passion.
Yeah.
And now you've been helping hundreds and hundreds of people, right?
Yeah, definitely. In the clinic here, we see about 25 people a day. So,
That is great. That is great. It's fantastic. Thank you very much for that story.
mhm.
Now, let's get down to it. Tell us what happens when someone leaves things improperly.
So most of the time when people lift things improperly, it comes from improper biomechanics that they've developed over a period of time. And everybody knows that you're supposed to lift with your legs, not with your back.
Mhm.
But what happens when you're on a job site and it's towards the end of the day and you got to get something done, right? You move quickly, you move with less effort,
Mhm.
and then that cycles into an improper lifting motion that can really, really injure you. Um, so a lot of times there could be a really small injury right in the beginning,
Mhm.
but that creates a lot of dysfunction in the muscle firing pattern, right? Because every time we do a movement, there's a series of muscles that fire and a series of muscles that brace for the movement. And they need to happen like simultaneously in a split instant. And if there's a small injury and the information going down there isn't 100% clear, then that split instant can be off, in which case we get a sprain, things move when they're not supposed to.
Right.
Um, there's no bracing when they're supposed to be bracing, and these are
Right.
just the minor sides of it, right? In the case of my friend when I was a kid, he lifted something that his body couldn't handle in general, and the amount of pressure that he put on his back created it to pretty much explode underneath the pressure.
I
So
see.
these are the discs. They're supposed to work as cushions.
Uh huh.
And if we put too much pressure on them, they can pretty
Right.
much,
They
yep,
come out.
they squirt out. Um, and when that happens, that's when we get, pain shooting all the way down the leg into the foot. That happens a lot.
Wow. Okay.
And so the
How
ways
how do
to,
we avoid this?
right, the ways to overcome that is that you have to train your body to do proper lifting. And if anybody ever done a squat, if you Google how to do a squat, right, that's the proper way to lift something. And most people don't do them correctly. The form is off a little bit, or again, they get tired, they get a little bit more lazy, and then they don't do the proper motion to lift properly. But the more you do it in a daily routine, if you wake up in the morning, you do 20 of them before you get your day going, then you're going to find yourself doing them more frequently on a regular basis because your brain is hardwired to move that way.
Mhm. Correct. Correct. Okay.
You
Good.
know?
So we gotta check the correct way of doing the squat and just follow that and train ourselves on doing it. Even if we're a little tired, just make sure we follow the right way.
Yeah, because when you move quickly and you move lazily, then you end up hurting yourself.
Yeah, and we don't want that. Excellent. Now, what would be like your recommended or an excellent approach to heal from an injury of that?
Yeah, so great example that I have for you is a woman that I've helped just 2 months ago. She's all 100% better now, but she was a nanny, so a woman taking care of somebody else's kids, yeah.
Hmm. Hmm.
And what I experience a lot working with people like that is that they have to bend over to pick the kid up a lot.
Right. Correct.
And so a lot of times, even the side of a crib doesn't allow you to do that proper bending motion to lift the kid out of the crib. You have to bend over the edge
Hmm.
to get the kid out.
True.
So she was doing that. She injured her back. She thought she was going to be like that forever. Pain all the way down into the foot from the low back. And so the best approach that we have is to, one, you got to get it adjusted properly back to where it's
Okay.
supposed to be. And the adjustments themselves create the proper muscle pattern to firing again,
Okay.
right? Then I gave her home exercises to strengthen the low back and also function on doing proper squats. Besides that, I have a decompression table here in my office,
Hmm.
and what that does is it pulls these apart just a little bit
Hmm.
and kind of sucks that disc back into the joint space,
Cool.
which pulls the disc off the nerve, alleviates the pressure that comes and the pain that goes down the leg. So over time, through the exercises, the adjustments, and the decompression, um, that pain was slowly going back up her leg, and then just into the low back, and then through the same techniques over time, it heals all the way up.
Nice.
And the best thing about that is that now she knows how to do proper lifting, and she knows what to avoid, and she knows how to not re-injure herself.
Right. And she became all better in a matter of 2 months, despite
Yeah.
having pain going all the way down her leg, down to her foot.
Yeah, could barely walk.
Damn. All right. Well, I'm very happy for her.
Me too.
I'm, I'm so glad that you help her because just having one of the things that I've dealt with in my own life, I've seen others, is there there are a few things that are more uncomfortable than a back pain, you
Yeah,
know?
especially low back pain. You use your low back doing everything. Even, I mean, house chores are the worst for low back pain.
Yeah. I mean, I guess you can deal with like injuring, one of your fingers or maybe a shoulder. You can get by, but the back is just there's no way around it. So you have to get properly treated, properly looked at, and go with a chiropractor that not only sees you, but is actually putting his heart into treating you like the way you do with your patients. You really taking care, really going and inspecting what is really needed, and just following up because that is super important. We tend to go to chiropractors and then I've seen I just don't do whatever they tell me to do at home. That is a common mistake, but we do it. But when the doctor is checking up on one as a patient and actually taking time to make sure we do the exercise correctly the way you do, that
Hmm.
makes the whole difference.
Yeah, the other thing I see is when people don't follow recommendations, or they don't come back when we tell them to come back, they got to come back anyway because they usually re-injure themselves.
Yes, sooner or later they come back. So let's just do it. I mean, if we're gonna get fixed, right?
Right.
Let's just do it right the
Right.
first time, and that's it. So do what your doctor tells you. Excellent, very good. So let's see this next question, which is also very interesting because there are other chiropractors and other people either already on their careers, their professions, trying to help people, but at the same time, it gets mixed up with running your clinic as what it is too, a business, right? So sometimes it's a little bit like, okay, I want to help people this way, but I gotta turn this business into something also profitable for me to be able to live. So tell us, what has been one of the most difficult times you had to push through in keeping your clinic's business affluent, and how did you get out of it?
One of the big changes that I made in my clinic, that just made it easier for people to accept care and for people to see the end result, right? Is that I started just charging a flat rate for the result instead of charging per visit.
Uh-huh.
Because when people start doing per visit, then they start calculating in their head how much is each visit, what am I getting out of each visit, where that's not really what we're doing.
Right.
We're fixing somebody, and we're changing their life. So so once I got through changing that aspect of my work, then it was much easier to for people to pay, for people to get better, um, and also working with you guys made it so much easier as well.
Thank you. Thank you very much. We've been very happy to work with you, and we love what you do. We love hearing the stories of your patients and how you've been helping them. So it's been, I guess it's been a great teamwork. So thank you very much.
Yeah.
All right, now, well, I guess we touched a little bit upon this one, but here it is. What has been your experience with marketing, helping your business or clinic grow?
Um, I mean, for me, in this kind of highly condensed, populated area, I mean, online marketing has been the go-to for me. I have a family, um, and I used to spend time on the weekends trying to go do things, go to farmers markets and, community events and things like that. But the amount of people that you can communicate with that way is so small compared to the amount of people you can communicate over the internet. So I mean, for me, the whole marketing tool of being able to be online and also having somebody else run that for me, because I'm not an internet marketing guru, right? I'm a chiropractor.
Correct.
Like, my superpower is helping people and fixing people, not messing around on the internet.
Correct.
So yeah, I mean, working with you guys has really let me progress here and grow here. So I mean, online marketing and having somebody run it, and somebody run it who does it good.
Fantastic. Excellent. Thank you very much, doctor, for that. Is there any other like tip or advice in regards to keeping our health that you'd like to share with the audience?
I mean, yeah, there's a bunch of pillars of health that really encompass it all, right? It's staying away from sugary processed foods, getting solid hours of sleep,
Correct.
getting your body moving and exercising and actually breaking a sweat, getting your heart rate up, um, and getting adjusted by the chiropractor.
Go to your chiropractor and don't just go to one therapy session. We actually need to get a result by just going.
Yeah, and just like every profession, there's gonna be people that you don't like in that profession. So,
Yeah,
if one mechanic doesn't fix your car correctly, it's not like you're gonna quit, right? You got to just find another mechanic.
correct, correct. They got to find you, for
Yeah.
example. All right. Thank you very much, doctor. It was very interesting, very valuable too. And before we go, please tell us how can people contact you or your clinic?
You know what? My website, congruentchiropractic.com, has online booking there. My phone number is there. The address is there. Really easy to find, and I'm there.
Fantastic. Well, this takes us to the end of today's show. Follow us and comment on any questions that you have regarding health, expansion, marketing, or any other subject that you guys would like for us to take up on this show. Check out expandthefires.com and let's just keep the fires of expansion burning even higher. Thank you very much, Doctor. We're going to say goodbye to the audience. So, see you in the next one, guys. You have a great day, Doctor. Thank you very much.
Yeah, you too.